So when we were trying to decide on my talk this year, Molly and I actually connected a long time ago with her hormonal issues, and that was my area of expertise with both PCOS and Hashimoto's, and has led to me getting to be part of Girls Gone Strong, which has been really great. And so while not everybody here has a thyroid issue, you probably know someone who does, or you have clients who do, and they tend to be those women that just don't respond to everything we do, right? It just doesn't make sense. They've got a good diet, they're not eating garbage, they're doing this, they're doing that, they're training really hard, and not only do they not get anywhere, sometimes they get worse. They're also those clients that overtrain really easy, and they show up to work with you, or you might feel this way too. You go for that second workout during the week and they just can't cope with it. So there's a lot of things that we know about weight loss and fat loss for women that just have to be tweaked a little bit with these particular women so that they can get better results. And many of the things we recommend for other people not only don't work as well for them, it's really easy to have it backfire with them. You might have even worked with people that they're doing everything right and they gain weight. This can be a piece of that. So anybody here want to share if they do have Hashimoto's, which is autoimmune hypothyroidism? There's some. Okay. It's the most common autoimmune disease in the Western world. So you probably know someone who has this, but a lot of women have just garden variety hypothyroidism and they don't know that they have Hashimoto's, and that can be really a challenge for you and for them because they've never been tested for it. Because in our Western model, we've got the replacement medications, which is great when you need those, but they don't really do anything for the autoimmunity, so they don't always even check for it because it really doesn't change their protocol and the way that they treat these women. But there are so many things when it comes to their diet, their lifestyle, and how they work out, and to even be proactive and prevent other autoimmune issues that they really do need to know. So if you have any clients who don't know, but you know they have a thyroid condition, make sure they're getting those antibodies checked, and we'll talk about what those are, because it really does change how you can work with them and get a lot better results. So really quick, in case you don't know, hypothyroidism is a pretty hot topic right now. I feel like every time you sign online, there's a cure for hypothyroidism and the Hashimoto's diet. So it is pretty popular, but there are a lot of ways that you can come about having a slow thyroid. And the main one is the autoimmune variety. That is about 90% of hypothyroidism. That said, you could have any one of these alone, or they could also have all of these things also going on with their autoimmune condition. So there's different ways that your thyroid can be impacted by a variety of things. So not that you have to memorize this, but just to understand, for the thyroid cascade to work, you're getting signals from your brain, both your hypothalamus and your pituitary, and they're sending a signal to your thyroid gland to make its hormones called T4 and T3, mostly T4. That has to be worked on by your liver and some other places, mostly the liver, to get converted into the active hormone that you need. That has to then get carried around with a carrier, and then it has to pop off of that carrier in order to work. So that's why we look at free T3 and free T4. So you might have heard those terms if you are a thyroid patient. And then it has to get onto the cell and have its activity. So you can see that whether you have the autoimmune cause or not, there's a lot of ways that this can go wrong for women. So I'm going to go back, and men too, but we're talking about girls here. So things that can impact anywhere along that cascade, which some of us may have to some degree. So if you're one of those people who has had kind of some wonky thyroid labs, but you got a little healthier and it was restored, you might have had some of these other issues going on and not so much the Hashimoto's issue. So inflammation and stress can impact our brain really profoundly, and they're going to slow that signal to your thyroid. So those are definitely things we can take care of. Serotonin and dopamine, things that when those chemicals are low, we feel depressed and unmotivated. Those also, the nerves that innervate those parts of your brain that tell your thyroid what to do are really rich in those neurochemicals, so they're really important. So sometimes women are depressed, and that might be impacting their thyroid, or they have a low thyroid and it's making them depressed. So you're going to see how this is very much a big web. Estrogen issues, so when we talked about that carrier shuttling the thyroid hormone around, if we have too much estrogen or an estrogen dominant situation, or even taking estrogen related medications, it can shift the amounts of those proteins that are available, and that alone can cause someone to be hypothyroid. Now, this doesn't mean that every woman that, let's say, takes a birth control pill or takes hormone replacement is automatically hypothyroid. It does mean there's an effect, but it just depends on how big of an effect it is for that woman. So let's say you've got a really stressed out, really inflamed, autoimmune person who goes on the pill. There might be someone who would start to feel the effects of a low thyroid with that. So keep in mind, you can have all of these things going on or just one. And you can intervene on any of these levels to make things better. Or what we want to do as women working with them is to not make it worse, because we want women to be exercising and getting healthier. But sometimes we'll talk about why that can backfire a little bit. So these are the two tests. And the reason I bring this up, even though you guys are not the ones ordering this test, is, again, some women have never been tested. They're like, I've taken Synthroid since high school. I have no idea. So I do think it's important to know, because again, there's all the things we're going to talk about today that can be really helpful for them, and they can do more than just take their medication. So my goal is never to say, we're going to try to get somebody off their medication. If their thyroid can't make it, every cell in your body needs thyroid hormone, so we have to take it. So that isn't the goal for me. The goal is, can we do all of these other things to help you feel better and not have your dose be going up constantly? And a lot of women take the medication, their levels look fine, and they still feel terrible, and that's because of all this other stuff that we'll talk about that's going on. So I think it's important to know so they can be proactive and feel better, but it's important if they get both of these tests. So most commonly what is checked for is TPO, and that's an antibody to the enzyme that catalyzes the reaction to make these the hormones in your thyroid. But there's also thyroid globulin antibodies, so that's another. Used to be called TAA, now it's mostly called TG antibodies on a blood test. That one gets missed all the time, so women think that they've been tested and they maybe haven't got this one run, and that's the one that's positive for them. So we had a question earlier about Armour. I might circle back to the difference between natural and synthetic thyroid replacement at the end. But so it is important, if you have people you know or yourself, if you think that you're in the clear, it's always a good thing to be checked for these. And I screen women for these at least once a year, even if they don't have thyroid issues, because they can be positive for up to 8 years before you have enough destruction of the gland that your labs look hypothyroid. And other times, women present hypothyroid. Like, you talk to them, they're cold, they can't lose weight, they have sluggish digestion, their hair's falling out, and their thyroid labs look okay, but all of those symptoms are coming from the inflammation and immune activation that are the Hashimoto's, which usually doesn't get checked until everything is really out of whack. So I screen everybody for it, especially if it really sounds like they have a slow thyroid, but everything is looking okay. And there are ways to get labs if you can't get them through your doctor, because sometimes the way doctors practice is they've got their model, and we're really working on optimal health and wellness, and sometimes that doesn't fit into the insurance box. So things like direct labs, and there's a variety of options for people to get that information if they feel like they can't get it through their doctor. So why is it so hard for our hypothyroid women to lose fat? Well, like I said, every cell in your body has receptors for thyroid hormones. So anything we think of with our metabolism, whether it's the metabolism of a fat cell or a muscle cell or a red blood cell, all of those things need to have good levels of thyroid hormone. So coming out of the brain, floating around on that protein carrier, coming off of that, and actually getting into the cell to work. So all of those things need to be working properly in order for anyone to accomplish, not only just accomplish their fat loss goals, but to feel good, to regenerate from something, to have an injury heal. These are also the clients that you probably see that are just injured constantly, or they get one kind of complicated injury like a shoulder injury or a knee injury, and it just will not heal. Those women are quite often fall into this category. So other ways that they could be struggling with their weight loss goals is they're training wrong for Hashimoto's, and we're going to talk about why I recommend doing things a little bit differently with these women, at least to get them in a better place before some of like the metabolic work and things like that can be more effective. Obviously, if you've got a client with a sluggish thyroid, and sometimes our fat loss and weight loss nutrition isn't quite on board, but if it seems like it is, then there are other factors that play into this. With the thyroid, it's never just one thing. These people also have blood sugar problems and adrenal problems. They've probably got some inflammation. They're probably eating some foods that maybe aren't the best for them. So food sensitivities and issues with reacting to things they shouldn't be reactive to. I mean, we really shouldn't be so reactive to the food that we eat. We shouldn't have so much gluten intolerance or dairy intolerance. But we have a lot of stuff that goes on with this leaky gut, which is just letting too many proteins through for our immune system to see and get agitated by. And this is more prone in these women because you need thyroid hormone to heal your gut. So they're kind of at a double whammy with the autoimmunity and then sometimes the low hormones. So when we look at these women, it can be really confusing when you're looking at them, like, why are they not doing better? So keep in mind, it might be this Hashimoto's aspect, but it could be so many other things because your thyroid is so important to everything that there's almost always at least one, usually 5 other things going on for them. And then inflammation that could be from their diet. Again, really reactive to too many foods, and a good gut healing protocol can really widen up the diet that they can have and feel good on. And then sometimes there's just inflammation can be just a consequence of having an autoimmune disease. And I'm using the term autoimmune disease. Does everybody know what that means? That is basically your body's decided some part of you, in this case your thyroid, doesn't belong to you, and so we start getting this aggressive attack on it. And so my job with women is to try to slow that as best we can and prevent other tissues from getting attacked. So training. Just by virtue of being low thyroid, they are going to be very prone to injuries that don't heal and tendinitis. So back to the idea that every cell needs this hormone. When it's low, you're going to have just normal metabolism is going to be slow, which is why one of the things we check for as a physician is slow reflexes when we look for signs of hypothyroidism. So the high rep, low weight for these women can be really tough because it's just a lot. They're really prone to repetitive use injuries. By the flip side, it's also, they don't do super well, at least when they're in a bad place, with a lot of metabolic training because they're so sensitive to overtraining. They get inflamed really easy. They don't have the capacity to recover, and I'm going to talk about why that is in a minute. So a lot of that stuff we want them to do, right? You want them to be doing more metabolic work and doing, more sprinting and things like that to burn fat, but they just don't seem to respond very well. And this can actually backfire really, really easy with them. Inflammation in general, they show up to their session, they're just really achy and stiff, especially in the morning, and just lots of signs of inflammation. And again, injuries that don't heal. So these, again, I think I've kind of drove this home, the overtraining idea. It's different for these women day to day. And I also want to make the point that some of you may have Hashimoto's or know people that have it, and they're really fine. It doesn't affect every woman the same. And it may, some women have it and they're like, it's not a big deal. I take my Synthroid and I'm totally fine. I can lose weight. I can do whatever. I don't have a lot of symptoms. And then you've got women who walking for 20 minutes puts them in bed for 2 days, but if they walk for 15, they're okay. So they really can run the gamut from woman to woman, from day to day as women go through other, I have some patients who every time they have a really long travel, they go across 3-4 time zones, wrecks them for a week. That's their thing, how they're really affected, probably because of their circadian rhythm a little bit. So it can look really different in different clients. So if you've got the ones that seem like they're doing good, maybe don't need to focus on helping them as much, but I'm seeing a lot of head nodding, that there's a lot of clients, friends, or maybe even some of you guys that just the standard stuff just doesn't seem to work. So hopefully we can give you guys lots of information to help them. But a couple of the reasons that this is such a problem, this overtraining, maybe adrenal issues, that they don't have the cortisol and adrenaline response, they don't handle the more metabolic training. But one of their biggest problems, there's 2 real big ones, and one is they have poor oxygen delivery. So very often they're either subclinically anemic or very close or overtly anemic. I can't tell you how much blood work I look at with someone who's just completely in the tank with iron and B12, and someone probably mentioned it in passing, but they weren't supplementing and fixing that problem. And so anything we try to do where we put them under, exercising and metabolic stress, they just don't handle it very well. And that can create, again, inflammation, blood sugar swings. Yeah?
Question for you. So when it comes to iron and so forth, say your iron levels are normal, but a lot of times doctors don't look at ferritin levels and such. Can that play a huge factor in your energy levels and stuff like that?
Yeah, so that could be the subject of a whole other talk. I actually wrote an article for Girls Gone Strong a while ago called Oxygen, the Fat Loss Nutrient You're Not Taking. So whether it's B12, B6 folic acid pathway or iron deficiency, those are going to be what I call metabolic deal breakers in functional medicine: inflammation, essential fatty acid problems, blood sugar problems, and poor oxygen delivery. No matter what we do with them, they're not going to get better unless we address all of those things. So yes, we do need to have, so serum iron, if you just looked at an iron level, doesn't tell us that much. We want to be looking at ferritin, the stored form of iron. And then we look at a couple of other things, something called TIBC. We'll look at that as well to start to see, are you going there? Because to me, I don't want to wait till you're overtly anemic or just because I can diagnose it that way. We want to make sure this pathway is supported, well before that. Because again, our labs are made to be very general. It's how we kind of organize our medical system. But we've got some people who feel terrible in much more of a gray range than waiting till they. So yeah, I did in that article, I talked about what tests I would like to see to really assess that. So the low oxygen delivery can also be because of poor circulation. A lot of these women have difficulty with the nitric oxide system, which is how we vasodilate. So some of the responses you might get from exercise, they just can't even get there. Like some of us feel really good after we exercise. You get that little rush of serotonin, lots of oxygen to your brain. A lot of times they don't get that. So those can be big ones. And then inflammation and oxidative stress when it comes to a little something called glutathione, which is our main cellular antioxidant. I like to say it's your bulletproof vest. It's how you take the hit from any type of oxidative stress. And we create oxidative stress when we work out, right? It's a good stress, but it still creates that for them. And if they struggle with that pathway, and this is, as far as autoimmunity goes, this is a really, really big one. And they will struggle with that. So if you've got someone who's got, they've got low oxygen delivery, they can't take the oxidative stress, they may also have, adrenal issues, because when your thyroid is slow, your adrenals they do this nice tug of war trying to keep going. So you could have glucose, some blood sugar problems, and then when we think of nutrient deficiencies, we talked about iron, but we have to remember, even though a lot of women are walking around with this is a chronic illness. So that's a stress on your body, and it burns through nutrients. So anything that might be compromised for them many of those nutrients, especially in the B vitamin family or CoQ10, they're part of our cellular energy, back to the Krebs cycle from chemistry and biochemistry. So they might be compromised just even on a cellular level, just even utilizing ATP to do what we're asking them to do in the gym. So hopefully this is making some sense of why these clients seem like just nothing really works the way we think it was. So oxygen being very important. Again, back to the anemia thing, and this can be B12 or iron. And again, I like to catch this early, so we like to do lots of blood work to see, especially if you think someone's got thyroid stuff going on, but maybe that's all they've had checked. So we want to kind of look at all these backup systems as well. And many have low blood pressure. So that is another thing that can compromise oxygen delivery. If you can't make your blood flow to where you're trying to get it because it can't generate enough pressure to get it there, back to low oxygen. So anytime a tissue is starved for oxygen, it's not going to function the way that we think that it should based on our protocols and our research and this person just having a normal physiology. So that could be because they've been under stress and their adrenals are a little weak. But remember, if you're talking about an autoimmune person, they may have autoimmune antibodies to their adrenal glands. So there may be some of this going on elsewhere. It almost always is in time. So the nitric oxide, that is part, again, of how we vasodilate our vessels. And there's 3 types of it. And the one that we get into a little bit of a problem with is something called inducible nitric oxide synthase. So that is going to be very inflammatory. So normally we have a bit of a balance because inflammation is something our body does normally. It's just most of us have too much of it. So with these people, what we want to do is sort of strategically help them get better circulation by upregulating this system in 2 ways, but not all 3. And nutrients like arginine, which we've probably all heard of, and it's used a lot of times in pre-workout drinks, that will raise it across the board. So arginine is definitely something I use with caution or don't use at all. But sometimes, they might be taking that because that's the only way they can get through their workout is to take their little caffeine and amino acid blend before their workout. And arginine is going to be in a lot of those formulas, and that can be bad for them. So what does that mean that they, upregulate this inducible nitric oxide synthase? It means they're going to get more inflammation. So the workout that might have been okay for them if this wasn't happening is going to really, really compromise them. And that's the thing that we have to think about as And I call you guys healthcare providers, in my opinion. You guys are the people that see these women more often than their doctors. They tell you stuff they don't always tell their doctors. And you just have such a greater opportunity to impact them. So I think it's important that we get this information that seems kind of medical out to everyone, because it might help you personally, but also helps us train these women in a way that doesn't make them worse. Because thyroid, we have thyroid hormone replacement, but what if they've got adrenal antibodies and our workout, you know, messes them up, and now we're worsening their autoimmunity everywhere. So stress, oxidative stress and inflammation. So this is caused by a lot of things. And again, we can't control everything that goes on in our world, right? We don't live like up on a mountaintop with beautiful clean air and perfectly clean food. Like, we live in the US and we have pollution and we have stress and we have, most of us have, you know, different jobs and different professional obligations. Many of us have families. There's a lot going on, and when I start talking about this, I can see everyone's eyes be like, oh my God, like, it's really scary, and you can only do what you can do. We do live in this world, and you have to kind of do the best you can as often as you can. But inflammation is caused by a lot of the things that we are doing all day. So your blood sugar being up and down, I'll talk a little bit about that, especially on the bonus day, about how to figure out what your blood sugar is doing in response to your diet. Food sensitivities, too much alcohol, chronic stress, lack of sleep, or any low-grade infections. This is where things like our gut infections or Epstein-Barr or chronic fatigue, some of those long-standing viruses can really be just an ongoing stress for our immune system and then our body as a whole. So inflammation is going to really profoundly affect how well these guys do. And then also back to this low glutathione issue. So back to another sciencey picture. So this is just what happens as we regenerate glutathione. So you have to have enough of this antioxidant in all of your cells, and then you have to be able to regenerate it. So it just goes through this little reaction over and over again. So we want to boost the level of glutathione for these women, and then we need to make sure they can push it all the way through this circle. So you can see here that selenium is part of this reaction, as is one of the B vitamins, riboflavin. So again, this is their bulletproof vest, and when this system is compromised, they're going to be the ones that overtrain really, really easy. So we'll talk about some nutrients and things that you can take. Actually, I don't think I put that slide in. So something I would safely say you could recommend to anyone with Hashimoto's is the nutrient N-acetylcysteine. So if they aren't taking glutathione support, they can get that pretty much anywhere, and I usually do 900 or 2 N-acetylcysteine. And I usually do like 900 to 1,000 milligrams of that a couple times a day. So glutathione, if it's such a great thing, why are we all not popping pills of glutathione? So typically this isn't absorbed very well in supplement form. So historically there is getting an IV, which is great, works really well, not very convenient. But you can use these precursors like N-acetylcysteine to try to boost someone's levels. There are now, as of the last year or so, some really kind of highly designed supplements of a form called, it's actually the S-acetyl glutathione, and that looks like it's absorbed a little bit better through the gut. So hopefully we'll have some other ways besides an IV to really boost these levels, because all of these women are going to need this on board for them to tolerate the things that just they're going to do in their everyday life. But then when we put them under any kind of, I keep hitting that, I'm sorry, put them under any kind of stress as we try to have them, many of them, remember, if we are hypothyroid, they're going to come to us wanting to lose weight, and they're going to be really frustrated. So when we talk about training and avoiding the overtraining syndrome, and now I should tell you guys how I kind of stumbled upon this. I had no intention of knowing this much about Hashimoto's or hypothyroidism when I started practicing, but I had all these women. I became like the hormone weight loss girl, and I had a large percentage of these women just were not getting better with anything that I did. It didn't seem like, they're gaining weight when they should be losing weight. They're waxing and waning, they're doing good, and they put on 5 pounds when nothing else changed. And I had to learn a little bit more about thyroid health, but I really had to learn a lot more about autoimmune health, because that is where so many things I learned I was making them worse, because I had never been taught this, and I didn't, and this was probably the case of many of my colleagues could attest to, that understanding this a little bit differently really changes how we help these women. And because they're coming to me for weight loss, I had to learn the hard way, and after a lot of years, what tends to work better with these women. But again, if you've got Hashimoto's or you're training someone with Hashimoto's and they're getting results with what you're doing, that's great. This is for those really tough cases, and there's probably a lot of them because I'm seeing lots and lots of shaking their head. So this is what I found works best for them, because what happens when you overtrain, then they don't get to work out as much, right? So you work out on Monday, you're wrecked, you can't go back and try to work out Tuesday or Wednesday. So what happens is they're getting one session a week, and that's not usually enough to get them where they want to go. So we have to do a couple of things. We have to try to have them work out more frequently without wrecking them, and this will always be a bit of a guessing game. This is kind of a template to start if you want to think about it the way that I do it. But then we also want to make sure that we're putting on some lean mass, because many of these women have felt so crappy for so long, they haven't really been working out, and many of their trainers, they see like, oh, this person has a chronic issue, a thyroid problem, I'm just going to go really light. Like, we're going to stretch today. And then they're not getting anywhere. And so there's kind of an art between not making them crash and not make them worse, and put them in a position where they can continue to work out a couple times a week, but get them some results and avoid what can typically happen. So for me, this is what I've started doing over the last 5 years or so, and it has finally, started to work with these women. So putting the bigger lifts where they're getting more, not so much the metabolic training that I tended to always recommend for them for fat loss, but putting on some muscle and putting them in a little bit of more of an anaerobic capacity up front, because they have all these oxidation issues. And sometimes this is all they do. So ultimately, I would like to have them do this whole workout, but instead of just opting for the metabolic circuit, then they might just opt for this first 5x5 up front. So I usually will do 2 exercises, like a squat and a deadlift. Sometimes they do 2 sets of those. So they'll do 2 exercises in a 5x5. And this is plenty of rest. So they have lots of time to recover in this. This isn't metabolic work. And then they could go into another set of exercises of the 5x5 with 2 exercises, superset again. And then if they've still got it, then you can put together a little metabolic circuit, and they're going to get better results from that second circuit by not being completely fatigued by doing a full 20 to 30 minute metabolic work. I think you guys are getting these slides, right? Yes. I don't see Cass or Molly. Yep, okay. So this allows them to be put under a different type of stress. And I think when we go for sometimes just the metabolic training, I was always putting them under that kind of stress that they couldn't handle. And then they couldn't work out again, or they didn't come back to me because I didn't know what I was doing. And this also gets a really good growth hormone response, which for women, we don't get a lot of testosterone response, but we do get a pretty good growth hormone response. So when it comes to triggering those lean hormones, that's going to happen from this workout. And again, it allows them to work a little bit more anaerobically versus kind of toggling between the two when they're doing the metabolic circuit. And this also, to me, seemed like it really, when I started it, a good way to circumvent some of that oxygen delivery problem that they have. And then again, they can sometimes get as much effect from their metabolic circuit with a little bit shorter time. So that ends up being like 15 to 20 minutes at the end, maybe a little bit less. And again, with these women, you might have to customize it day to day. You might have to customize it when they start going through menopause, everything's going to change. So women, we have these lovely fluctuating hormones that are going to be very different when a woman is pregnant or postpartum or going through menopause. So it does really change, and their autoimmunity and their thyroid will change during that time too. So I start with those 2 up front, and if they've got more and they feel like they can listen to that and trust it, then we can move into the metabolic circuit. So that's how I've started to strength train these women, and it really has been finally pretty, very effective. So we talked about that a little bit. So nutrition, what should these women be eating? So the paleo diet is a great template for them because it gets out a lot of crap, it gets out a lot of garbage foods, it gets out sugar, and then again, they're the ones that have all these food sensitivities. They're the ones with a lot of leaky gut and more reactivity to their food. So this, just by virtue of going on this, eliminates a fair number of the things they may be reacting to. So it's a good template, and I do recommend things like the Whole30 pretty frequently because they've got so much support, and you can get them through a couple of weeks. They start to feel better, and then you can kind of figure out like what's the next step. I really hate the idea of the cereal Whole30, where it has become the new yo-yo diet, where you go clean paleo for 4 weeks and then you go back to eating everything and then you just do that again. Most of my conversations start with women saying, well, I've done 7 Whole30s and every time I feel really good, and then I just go back to what I was eating before and I don't know what to do. So I do a lot of coaching of during that process, what are we gonna do now? What about this could you keep doing? What about this maybe you don't like, but you clearly feel better and are willing to work on some habit change for? And what about it do you absolutely hate? Didn't seem like it made a big difference. Let's put that back in. So I like that as a template for these women. We're going to talk about gluten in a second. Some women are they're again, very, very individual. And so if you've got someone who has a lot of autoimmunity or they seem really inflamed still, like they take out some of these foods, nothing really changes, there is that autoimmune paleo protocol where they also take out eggs and nuts, I think, and nightshades. And then I wanted to just note that I think it's still being talked about as like, well, gluten is allergenic, but foods like rice and potatoes, those are hypoallergenic and you can keep those in. And that is just not necessarily the case. It may be true for some women, and we do food allergy testing in my practice and we end up with sensitivity to quinoa and brown rice and some of these carbs that they're gluten-free, they're good carbs, they're high fiber. So nothing is off the table for these women because we have the digestive expert here in the back. So we might want to field some of these questions to Dr. Jillian here too. But anything could be a sensitivity for them. We can't just assume that, well, that's typically hypoallergenic or it's gluten-free, so it's going to be okay. So what do we do with them for finding some of these things out? So I do food allergy testing in my office. I use a company called Cyrex Labs, and it's the only one that I use because we have to remember much of our food allergy testing is dependent on someone having a normal immune response to the way they test it, and these guys don't. So this is the lab that's taken really good care to work with this funky autoimmune special population. So that's the one that I do, and I've linked to them a number of times in my thyroid blogs for Girls Gone Strong. But again, that's where you would see some of these sensitivities. So if someone doesn't want to commit to a trial of a Whole30, they could do the testing. For some people, they don't want to spend $300 or more on testing, and they just want to cut those things out and see if they feel better. And that's fine too. It's sometimes a little bit tricky to help them introduce them, but that can be a way to give you kind of a clean slate, start putting some foods back in and see if they still feel, okay. Other aspects that they need to be thinking about is they almost always have some sort of blood sugar issue. Many of these women have insulin resistance, and many of them have reactive hypoglycemia because they have weak adrenals and can't tolerate a lot of carbs. So they very much are somebody that has to figure out their carb sweet spot. We don't want to go too low carb for them because that tends to slow their thyroid down in and of itself. But because so many of them have compromised blood sugar regulation on the other side, we have to be careful too. So they are definitely in the group that it's worth watching some of those symptoms to see how they feel on different carbs and on different types. So I call that the unique carb tolerance, which just means how do I feel on a half a cup of pumpkin versus half a cup of brown rice, a quarter cup of pumpkin versus a quarter cup of brown rice, and have them just watch for their symptoms. This is all over my blog too. So symptoms that they're getting the wrong carb, like they might be sensitive to it, could be anything from obviously digestive upset, headaches, stuffy nose, skin issues. Sometimes those don't happen quite as quickly, or getting really sleepy, or even having their heart race after they eat the foods. But when we're talking about just blood sugar regulation, let's say I ate 3/4 of a cup of sweet potato and I get really sleepy after. So if I'm sleepy, I start craving more carbs, my hunger goes up, or I just want to finish the rest of that sweet potato even though I'm not really hungry, I just know I want something more sweet. That's a sign that either that carbohydrate or that amount was too much for me, and I've now gone into a little bit of over insulin secretion, and I do have PCOS, and so that is the thing for me. On the other side of it, we've got women with this weak adrenals, and they can't keep their blood sugar up without an adequate amount of carbs. So they're the ones who are getting tired between meals, not tired after, tired between. Energy goes way, way down. Sometimes these women, they're running on so much adrenaline, they just forget to eat. Those tend to be the ones that need to schedule the meal in for themselves, or they get irritable, cranky, lightheaded, any of those things coming up on mealtime, or they don't even notice it, but they're kind of like personality change, and they eat and then they just come alive and they're back to themselves. So, and many women, like this is me, I have both those problems. So I have to kind of eat the right amount of carbs, the right kind, and at a certain time, but that's just what is my little formula, and that's not necessarily going to be something you can use for every woman. But it does, their symptoms are talking to them, and I really feel like this has become my life's work, is to teach women how to listen to their hormones, because they're talking all the time. We just don't always know how to read those symptoms. So, and then just mentioning, so normalizing the blood sugar and adrenal issues, and then alcohol can be more inflammatory for them, again, than for someone else. We get into complicated issues with detoxification. If glutathione's low, their detoxification is going to be low. We talked about this, I think, in our advisory board group a while back, of some of these women will say, sometimes I can have 2 glasses of wine and I feel fine, and other times I have a glass of wine and it's like I got hit in the head with a bottle after I drank 2 of them and just feel terrible. And they don't always know when that's going to happen. And that has a lot to do back to that glutathione system, because it is not only part of them being able to take that oxidative hit, it's part of detoxification in our liver as well. So you can see where that's a big one, and all these things kind of run together. So gluten, I'll open up a can of worms here. So people suddenly have really strong opinions. I see the I Love Gluten t-shirts, and so gluten-free, whether we have an emotional attachment to being gluten-free or thinking that it's fine, I definitely think when you look at all the research, not everyone in the world needs to be off gluten. There's some probably problems with hybridization and stuff that we've changed our food supply, but we've done that to a number of foods. It's not just gluten. But the research for Hashimoto's is really definitive that they tend to be the ones that need to get off of it. We're sort of extrapolating out that most people with autoimmunity are going to do better off gluten. So you will have some people that take this out and they, like, the skies just part, they lose 40 pounds, and it was just like this huge lift of inflammation, and it's great. Other women that I know I don't feel good but I kind of cycle on and off of it. And then there are women that took it out and it didn't really change anything for them. So if they have Hashimoto's, I still recommend, even if they've been tested thoroughly. So again, I do the Cyrex testing for this because it tests for the many, many ways. There's 9 to 11 ways we can be reactive to gluten that have nothing to do with celiac disease. So we can be reactive to components that form when the the wheat has been sitting in a bin, or we actually do some things to wheat to make it go through a machine so we can make junk food and Doritos and things. Some people react only to that form. Some people react to something we do to it in our own metabolism of it. So there can be all of these different ways to react to gluten, and they can have a lot of symptoms. It's not always digestive. For me personally, I feel very depressed and a really horrible fatalistic funk for about 48, 30 hours after I have it. Doesn't do anything to my digestion at all. So just keep in mind that it doesn't have to be gluten-free for everybody. Definitely something to try if you have Hashimoto's or other autoimmune disease. And we can't just gauge, did you have a tummy ache after, as the only way. So it is a real life-changing experience for some people. That just tells us they were really reactive to it. They were really, really inflamed. But the research does definitely warrant at least a trial. And my advice, if we tested them, they're not very reactive, or maybe just a little bit, and they don't feel any better, then I say don't panic if there's like a little of it in your life. But if you have Hashimoto's, maybe you don't eat it every day. And then we've got other people who it's really hard for them, but it's really, really important because they're so inflamed and such a mess, and then their antibodies go off the chart after they had it. So we can really tell that it's impacting them. So back to something like the paleo is a really good template for that, just to at least get them started and see if they feel a little better, and then you can kind of explore other options for what should be the long term. I mentioned the idea that nothing is really hypoallergenic. And if you think about, for some of us, when we've been dieting, what are we eating every day? Rice, chicken, broccoli. You could be sensitive to any of those things, especially foods that you eat really frequently. They're just things that your immune system sees more often. And if you've got any issues with your immune system or a leaky gut, your immune system's seen that protein a lot. So nothing's really off limits if you're working with somebody in this condition. And just remember, when someone says, well, I went gluten-free and I didn't lose any weight, and it's like, well, you're eating gluten-free muffins 3 times a day, and candy's gluten-free, and diet soda's gluten-free. And so we just remember that gluten-free doesn't necessarily mean a healthy diet, doesn't necessarily mean a low garbage diet. How am I doing on time, Cass?
No.
I'm good? Okay. I thought you were giving me a look.
No, I'm sorry.
Okay. So all these other things still matter. How many carbs they're eating, what's their tolerance, enough, not too many, calories, stress, sleep, all of those things still matter when they're on the gluten-free life. So again, sometimes we get a really easy win when we take them off gluten, but it's just not always the case. So blood sugar balance, after getting the foods out of their diet that they're eating, and the reason that's so important is not only because they have this overactive immune system, but if we think about, let's say I've become sensitive to, use chicken as an example, and I eat that twice a day, every single day, I'm dosing myself with something that's not the best for me over and over again. So we sometimes think of it, well, it's healthy, it wasn't McDonald's, you know, it's low carb, so it works for my goals, or it's whatever. But we kind of miss the point that we could be sensitive to anything because we've kind of got it in our head that this is a good food. Like sweet potatoes, really, really good, right? Chicken, really good. Broccoli, good. So we have this idea of whether food is good or bad, and not necessarily, is this something that works for me or not? So that is important. So we're dosing ourselves with something we might be sensitive to a couple times a day, but also we're eating at some sort of interval that may or may not be working for our blood sugar and adrenal issues. So remember, we can get the foods out. So now say they're following something like a Whole30, but one of the things that we recommend in the Whole30, right, is 3 meals a day. The primal crowd is really big on that. And that doesn't work for everyone. Sometimes when we do only 3 meals a day, we go home to dinner and we haven't eaten in 6 hours, and we eat 2,000 calories while we're prepping dinner, right? And sometimes our adrenals just can't handle it. And so 3 o'clock comes around and we're craving sugar and coffee and all these things, something at Starbucks to get us through the afternoon. And if we just kind of stick to some arbitrary rule, and these guys might be doing that because they're involved in that program. So we really want to look at individually kind of helping them keep all of their hormonal systems in balance. So they most likely will have some sort of blood sugar problem. So working on the diet to help them, because remember that causes inflammation, right? Just having wonky blood sugar. And for somebody that might be skipping lunch or going too low carb or going too low calorie. Those might be things that are making them have more inflammation. So it doesn't matter what else they do, they're not getting on top of that. So this is what I talked about earlier, the unique carb tolerance. So again, how much and what type and what are my symptoms when I do those things. We have another blog coming up, I think, on Girls Gone Strong, where I talk a little bit more about taking your own blood sugar, because that can be a really valuable tool. And it's pretty inexpensive. It hurts a little bit, but you don't have to do it forever. You can get a lot of information from looking at that just for a couple of days. Because some women can't tell, right? Some women are like, I don't know, I ate the sweet potato, I ate 2, I ate 1, I kind of felt the same, but then we look at their blood sugar and it was going really high. And I think women in particular, we get really good at ignoring that stuff because we have stuff to do, right? You can't be sitting around thinking about how tired you are after your sweet potato when you've got like laundry and kids and work and gym and all these things to do. So sometimes we've just gotten really, really good at not listening to ourselves. So that's when the blood sugar monitoring can be a really pretty inexpensive but really insightful tool. And I actually put a blog up on my blog recently that had the numbers if someone does want to check it. Keeping in mind, like we do have to really, these women tend to want to go low cal and low carb because they're so frustrated that they haven't lost any weight and they're working so hard. But that will impact their thyroid and it will sometimes raise their cortisol. So we do really have to work with them a little bit and kind of find what is their kind of magic carb number that keeps them from going into a lower thyroid place. So carb cycling works really well with these women because you can take a couple of days to give them a little bit low carbs and then go back up. And so I usually try as a rule to give women as much food as we can while they're still getting the results that they want and just kind of pare back from there. But the carb cycling, while it is a little tedious to not just intuitively eat, although many women I work with in time, they do intuitively just carb cycle. Like they kind of just know that they kind of can listen to those signals. When they first start doing it, it can be a little bit tedious, but it does really help keep them moving in the right direction without going into too much stress or a too low thyroid place. So I usually kind of start where they're at. If they are eating really low carb, like Susan was talking earlier about 50 grams, then go up to like 100. If we go up too high, that's when they tend to gain weight. And even though we know it's probably not going to stay, they don't like that. So take them where they're at and add 50 to 100 and that start to move them in that direction. And then you can vary the amount of days. Some women will do a carb cycle for 3 days, and that's not a long enough time for them to get results. But sometimes if we go 5 days, that's too long. So tweaking those variables, it's again a little bit tedious, but it really does help manage. Keep in mind with these guys, you've got to manage so much stuff. They got inflammation and weak adrenals, and they're trying to work out, and they're insulin problems, and you don't want their thyroid to go low because of a low carb diet or overtraining. So you kind of are chasing a moving target. but this can be a pretty good tool to work with them. And then another thing to try really easily is we've got the carbs at night versus earlier in the day. I know before I was always taught, you're most insulin sensitive in the morning, you can only have carbs in the morning. Then we were taught, no, only have them at night. I think it really depends on the person. Some people who only have them at night, again, have that really, really ravenous feeling come dinner and they overeat. So sometimes that works. Sometimes, me personally, I have insulin resistance, so if you've got someone with insulin resistance, I can't do too many at one time, or that really blows up, unless I really needed to knock myself out and go to sleep, then I could eat a bunch of carbs and go to sleep. But for me, I do better with a little bit spread throughout the day. So more tedious, but that's what I found works better for my energy levels and my results. So those are all variables you can play with, trying to avoid keeping from taking them too low carb, which can blow up in our face with the thyroid. And the list goes on. These people always have something else. So we talked a lot about the ways you guys can impact that with food sensitivities, how often they're eating, tweaking their carbs, and how you're training them, and at least one supplement. I didn't get too much into supplements, but there's a lot of things we can do now in natural medicine that have a really great effect, like vitamin D and turmeric, at quieting down this overreactivity to which is autoimmunity. So there is a lot women can do. They don't have to just accept that they only get their thyroid prescription, their Synthroid or Cytomel or whatever, and that's it. There's nothing else they can do. There's a ton else they can do. And that really takes them from feeling like, I feel better than I did when I was hypothyroid and needed medication, but I don't feel great yet, or I can't quite get the results. And they also have other issues that might be looking at a beautiful diet, but they're not getting the nutrients from that because they quite often have low stomach acid, low digestive enzymes, and they might need to take some of those things. So those are all going to impact back to like those nutrient deficiencies and whether or not they're able to heal from an injury as well. And I run a lot of autoimmune testing in my office, especially when I have a person, let's say with Hashimoto's, and they're eating a really good diet, they're getting enough sleep, they're managing their stress, but it doesn't matter how good their diet is, I cannot get their blood sugar to be more stable, or if they go off just a little bit, those are quite often have adrenal antibodies. So this is usually somewhere else too. So remember that too when they've got, you've got a woman who's 28 and has osteoporosis. That a lot of times has to do with autoimmunity, or again, they're just not recovering. They're having issues that, trying to think of another really good example you guys are going to see. Tendinitis doesn't always have to be autoimmune, but insomnia, that could be another manifestation of adrenal antibodies too, or thyroid antibodies. So it's almost always somewhere else. So just keep in mind when you're kind of looking at them as a whole person that it always goes beyond their thyroid. So this is it. That's how it goes beyond their thyroid. Your thyroid impacts your brain, your digestive tract, your liver, whether or not their cholesterol is going to be elevated. Got to have enough oxygen. So thyroid in and of itself is important for a healthy formation of a red blood cell, making your hormones, when we talk about estrogen and progesterone. And those for women also profoundly affect how this whole thyroid cascade works. So again, you'll see maybe a client or yourself, everything was fine, then you had a baby, and then everything went to hell. I mean, everything goes to hell in another way, but everything goes to hell with your thyroid as well. And I was like, I haven't slept in 4 years. I was just relaying to someone how no one warned me of this part of it. But it really does impact everything. So if you've got someone whose doctor's not taking it seriously, or they're not, paying attention to taking care of themselves, it is going to impact them on so many levels. So this is a really important thing for them to have sorted out. And it's a really, I've kind of gone through this already, and it's a really important thing for you guys, I think, that see them so frequently to have a lot of impact for them. So I think we talked about that as well, kind of ending with it is always 5 other things. They don't just have a thyroid problem, they've got adrenal problems, usually there's estrogen and progesterone problems. There's a lot of stuff going on for them, so give yourself a break if you've got those clients who are just like, I don't even want to see them on my schedule tomorrow because I know they're going to come in and be like, I couldn't do anything that you had me do outside the gym, I feel terrible, that last workout just wrecked me. So these are those women, but we have to help those women, because no one else is. And a lot of the stuff, especially right now in the online space that I'm seeing, is just really, it's not good, because not only, maybe they're going to spend $100 on something that's not very effective, but when we're thinking of, does this person also have cerebellar antibodies and they might end up with MS, and we're doing stuff that's going to make them worse? Like, we take that really seriously. So I think it's important for these women to know they have this, and to be working with all the beautiful, smart girls that are here that are trying to do, better by these clients, because I think they're the ones you just want to go away. Because you're like, I don't even know anymore. And I felt that way for a long time, but there is a lot they can do. So that is kind of the recap, I think, and that's me. And do I have time for just a couple questions? Maybe you want to start the round table? Okay. I finished on time.